long tradition of working in a bipartisan way, and this issue is so crucial. It's exactly what we're going to need. Senator Thune is next.
Thank you, Mr. Chairman, and thank you, Dr. Murthy, and thanks, Chair and Senator Crapo, for addressing this subject. This is a subject that is increasingly on the minds of administrators and teachers, parents and students across the country. Very real when you talk to school administrators, just the uptick, the statistics don't lie. Clearly, these mental health issues are having a tremendous impact on young people to the point that they are, in many cases, taking extreme measures, and we hate to see what's happening to our youth across America. I want to ask one question. This is a controversial subject, and I know it, but we're in the third year of the pandemic. Fatigue is with public health measures is set in. We know a lot more about this than we did in 2020. In March, and yet communication is still confusing and in some cases inconsistent, and I think it's undermined Americans' confidence in public health officials. Specifically, HHS has pushed a toddler mask mandate in Head Start programs in the U.S., including outside on the playground. Not even the WHO is recommending masking kids under 5, and at the end of last year, President Biden said pandemic response needs to be at the state level. Yet the administration is taking the decision out of the hands of folks on the ground, and there are a number of states who are announcing now that they're going to do away with mask mandates in their states. So I know this is it probably requires a lot more time than we have, but could you just tell me where the science is on this, on masks, and what should it be? Should it be a federal government thing, or should the states be able to make these decisions on their own?
Well, Senator, I appreciate that question. And I think you're exactly right to point out the fact that year 3 going into this pandemic, there are a lot of people who are frustrated, who are tired, who are exhausted. And I think we've got to take that into account as we think about the next stages of the response. When it comes to masks, Senator, what we know, we've learned in the last few years in particular, is that masks are a helpful tool to help reduce spread of the virus. When we look at schools, in fact, that have masking, there is less spread, and there are, in fact, fewer school closures as a result of there being less spread of the infection. Now, do parents in an ideal setting want their kids in masks? No parent would want a mask if it's not needed. But I think what our goal should be is to get to a place where we can pull back on these types of restrictions as quickly as possible and as safely as possible. And in that process, there will be, I think, a very important role that states and localities play in tailoring the approach based on their individual community circumstances. I think increasingly, finally, as we look at this pandemic, we see that we have more tools now to help address the pandemic, to empower people, rather, to keep themselves safe, whether those are masks or therapeutics, vaccines and boosters, and an increasing supply of tests. These are all tools now that we can use to live our lives more normally than we did 2 years ago.
I think it's just for parents, kids, everybody, very frustrating, and I hope that we can get to a point, and I agree. I mean, I think states need to be tasked and enabled and empowered to make a lot of those decisions. Changing gears quickly, telehealth, we've got a couple bills. I've got one with Senator Menendez that would incentivize states to pursue certain health services initiatives under CHIP, providing greater flexibility to states that design initiatives to address behavioral health in schools. And we look forward to working with you on that. But a number of these solutions now include, within Medicaid and CHIP, telehealth. Do you think that's been a valuable thing? In my state, we have Oval School Health provides access to a school nurse and behavioral health services remotely where the workforce is not available. And we all talk about the need for more providers, which we don't have. But it seems to me at least telehealth can make a big difference there. Would you agree?
Absolutely, Senator. I think telehealth has to be part of our healthcare delivery apparatus going forward. I think the pandemic has helped us see how powerful it can be in increasing access to care. I think this is particularly helpful for rural areas where people currently often have to drive many miles to see a mental health provider, if there even is one in their area. So I absolutely think we have to implement it. That means expanding access to broadband. It means ensuring that we reimburse adequately for those services and that we have appropriate privacy measures in place for patients.
Thank you. Finally, the big tech companies' influence on young people today. We've seen all kinds of analysis and investigations and reporting on that. There are, for example, a Wall Street Journal detailed how TikTok's algorithm serves up highly inappropriate video to minors. I've got a bill that addresses that, would give consumers the option to engage with internet platforms without being manipulated by opaque algorithms. And just a quick question, do you agree that users should be able to use social media without being manipulated by algorithms that are designed to keep them engaged on the platform for hours on end?
Well, Senator, I do believe that people should be able to use social media without being manipulated, without having their data used in ways that they do not consent to. And I think all of us, particularly parents and children, deserve to have the data that technology companies have about the impacts of these technologies on our children. Currently, there is a grand national experiment that is taking place upon our kids when it comes to social media. And we need to understand more about what is happening, which kids are at risk, what impact these algorithms and the broader platforms are having on our children. So we need to understand that so that parents can make informed decisions for their children.
Okay. A big part of this problem, and I think one of our challenges, Mr. Chairman, in addressing mental health issues is the influence of a lot of these algorithms that manipulate the content that people, and particularly young people, see online. Thank you.